Hello, I'm Dr. Israel Barkin. I'm the Medical Director of the Prostate Cancer Research and Education Foundation. I'm going to present now an abstract of an article which we presented on Ask Dr. Barkin Call-In Show. Ask Dr. Barkin Call-In Show is every Tuesday, 6 p.m. Pacific Time. You could dial in by calling the number 1-877-727-3301. Let's go now to the article discussed. The name of the article is Androgen Receptor Expression is Associated with Prostate Cancer Specific Survival in Castrate Patient with Metastatic Disease. The article was published in the British Journal of Urology International. It was submitted the second part of 2009 for publication. The article was written by Michael J. Donovan, who is the Chief Scientific Officer from Orion Laboratories in Yonkers, New York. And the other researchers here from medical centers were from the Memorial Sloan Kettering Medical Center, from Yale University School of Medicine, and from Columbia University in New York. Let's go now and look at the objective. The intention is to study what role the clinical variables and tumor specimen characteristics before treatment can they predict what is the outcome on mortality and metastatic disease. So they included in the parameters before the treatments looking at androgen receptors, AR, and also look at clinical variables, and this will be discussed in a moment. So the survival of patients that have metastatic disease was checked according to their biopsy specimen and information on this patient that was archived years before that. So let's look now at patient and methods. Hematoxylin and eosin, these are the dyes that we are using to paint the slides for the pathologists to look under the microscope. They were used for outcome data from 104 castrate patients with metastatic disease. There were 43 patients that had prostatectomy specimen, and 61 patients had prostate needle biopsy specimen. And they reviewed it. The morphology, namely glycine, and quantitative immunofluorescence were used to assess the sample. Sections were analyzed with multiple quantitative immunofluorescent, and there is a list here of those substances that were studied by immunofluorescence. What were the results? The median follow-up was of 12 years. 49 men had baseline PSA levels of more than 20 nanogram per ml, and 53% or 55 patients had a glycine sum of 8. 60% died from the disease and 40% were still alive. The association with outcome was evaluated by statistical means, and here were the results. PSA was the only clinical variable associated with outcome. The amount of AR, which is androgen receptor, present with the tumor nuclei was also significantly correlated with greater risk of shorter time for the mortality. So I'll repeat it again. It was the PSA and the androgen receptors, the AR, that really predicted mortality in this group of patients. So the conclusion, as I said, increased nuclear AR expression in either diagnostic biopsy material or in the radical prostatectomy specimen from patients that already had advanced disease was associated with reduced time to prostate cancer mortality. Thank you for listening. I'm Dr. Barkin, the Medical Director of Prostate Cancer Research Education Foundation. If you want to listen to our show tonight, you could dial in the number 1-877-727-3301. You could dial this number anytime before shows just to post your question, and we will answer live during the show your question if you participate on the show. Those of you that did not have a chance to be on the show, they could download the show from our website, www.pcref.org. And for those of you that don't want to use the phone, you could use an audio streamline from clicking on our homepage on www.pcref.org. Thank you for listening. Bye-bye.